Terrorism and Emergency Response, Ashley Flannery and Sandra Hardison. September 11, 2001, at 8:46 a.m., the first of the Twin Towers at the World Trade Center in New York were hit. Young adults between the ages of 1830 through 30, both male and female within multiple races in New York, following the September 11 terrorist attacks involving the World Trade Center and the psychological effects for young adults in surrounding areas will be our target group. We have identified these health issues. Young adults in the direct area were majorly affected in terms of respiratory infections and disorders, as well as the psychological effects such as post-traumatic stress disorder and the onset of sexual risk behavior or substance abuse issues in some other cases. Decreased ability to smell was also a huge concern due to the high levels of air pollution affecting thousands of New Yorkers for around 6 months after the incident, which would also contribute to respiratory infection rates. Students in 3 separate North Carolina schools showed an uprising in PTSD symptoms, which was the most common health issue for young adults who were affected by the incident, including those who were geographically separated. There is a positive association between exposure to the attacks and symptoms of post-traumatic and global distress, as well as hopelessness and feelings of anger. Among the most helpful measures for young adults to release the stress that's caused by the events of September 11 are attending religious services, fundraising, and flying a flag, which seems to boost morale and patriotism in times of crisis. Some risk factors within the young adult age group were substance abuse and sexual risk behaviors. Women were more likely to report depression than men after the attacks, which can be problematic when elevated stress levels show correlation with elevated unprotected sexual activity. Ethnic and racial minorities in urban or lower socioeconomic areas have less access to mental health care, thus taking longer to psychologically heal from the attack than those in higher socioeconomical standing. One study, the participants were all from high-risk areas with higher rates of violence, teen pregnancy, and HIV STDs, and their responses to the mental disorders attributed to the World Trade Center terrorist attacks. For another, 4,151 women aged 16 through 24 and unmarried were the main focus, along with sexual risk behavior caused by psychological trauma such as the World Trade Center attack. A third study in stress response among different age groups selected 670 young adults, only 493 of which responded for post-traumatic stress disorder-like symptoms and responses. Essential services. There are nearly always studies being undertaken in the effects of September 11, 2001 events, since it is the most shocking thing most Americans will ever experience, and the mass effects of the fallout hit everywhere, not just New York, not just in the United States. Monitoring the physical and mental health of those involved with the World Trade Center attacks is beneficial due to the necessity of mental health services. With monitoring the issues, we have the ability to offer services that will enable people to regain mental stability, so to speak. Policy development. Several studies to determine the full effects have been conducted, as well as the starting up of World Trade Center Health, which is a program that monitors the health of people who are directly affected by the events of September 2001. Within 1 day of the attack, a free help hotline, LifeNet, advertised for people to call for help or counsel, which snowballed into Project Liberty, which was actively advertised for over a year after the attacks. From 9/01 to 12/02, more than $9 million was spent on Project Liberty, a media campaign encouraging people to seek counseling for the traumatic events of September 11, 2001, the 5 boroughs, and 10 communities in the direct area, along with New York City. Only 22 states required mental health care as of 2010. So there is a definite improvement in that area for those who are suffering from post-traumatic stress or other psychological maladies as a result of the September 11th terrorist attacks. The additional resources of the Affordable Care Act and the electronic medical records will make for tracking problems and changes in mental health a lot easier, which will make providing treatment a lot easier. Potential facilitators. New York State Office of Mental Health, CDC. Since the Center for Disease Control is basically a giant informative hive on all things public health related, their assistance in policy development for mental health in accordance with the Department of Health and the actual government for mental health awareness and availability of services, which is another thing that is supposed to be getting better with the Affordable Care Act. Potential facilitators. With information on how to address any mental health problems that may arise, it will be easier to combat the effects of depression. Agencies such as the CDC and most state or local health departments spend innumerable hours pushing for community education on health issues, especially those that can arise from mental disorders, such as depression. Since mental illness has such a stigma in the United States, empowerment is especially important. Project Liberty, as organizations similar to it, are designed specifically to inform, educate, and empower those in need of counseling or mental health services to reach out and obtain necessary help. Mobilizing community partnerships, bringing influential voices of the community into the campaign is beneficial because it spreads more information. Developing policies for terrorism and emergency response, as well as mental maladies that can be attached to them. Policy development. Since not all states consider mental health care a requirement, there is a definite need for improvement. New policies could include those that mandate mental health care is an offered service to those suffering from any kind of traumatic stress. For those who suffer severe anxieties, there could be services involving mental health professionals who come to the patient's home, thus lessening the opportunity of another traumatic event occurring. Assurances to enforce, to lessen the stigma involved with mental health disorders, to link directly after the attacks. People seem to be more interested in food, water, and making sure their loved ones were accounted for, so mental health services tended to be close to where information or sustenance was being offered. Assure, there are multitudes of ways that healthcare staff are trained in dealing with those who have experienced severe trauma. Most common mental disorder symptoms, triggers, and reactions that stem from trauma are well documented, and staff are generally made aware of the precautions to take while dealing with those suffering from mental disorders of any kind. Evaluate. Many different communication gateways, television, text, messaging, radio, internet. Mental health staff located in all hospitals or medical facilities. A number of those suffering from post-traumatic stress disorder as a result of the attacks requested psychotropic drugs intended on helping lessen the mental effects. Project Liberty provided crisis counseling to over 680,000 people, which certainly seemed like an effective tool for mental health services. In conclusion, the effects of terrorism and emergency response of the young adult between the ages of 18 and 30, both male and female Caucasians, majority in New York City following the World Trade Center terrorist attack, and the effects of those in the same age group who are geographically separated from the event showed the largest number of people who are affected by the depressive or traumatic stress disorders. Depression is known to cause substance abuse, risky sexual behavior, and women were more likely to report depression, anxiety-like symptoms than men were. The 10 essential public health services in terms of terrorism, emergency response, and mental health were set up to monitor patients in order to diagnose the problem, which seems to be mostly post-traumatic stress disorder in this case. Once we've diagnosed the patient, we can move on to giving them policies to prevent future occurrences and enforcing laws to further prevent as well as protect. The majority left up to the Department of Homeland Security. Office of Health Affairs takes on the medical health of the public in bioterrorism situations. By offering a link to mental health services, we are offering a wider range of support and furthering the spread of information, and especially when we assure the competence of the facility. Once those steps have been taken, we evaluate the situation and report our findings, positive or negative, to help future possible severe and nationwide cases of post-traumatic stress disorder after terrorist attacks.